other two things, very important things that one should know is what are the various side effects, that medical cannabis can cause, and how does one controls them as well.
So coming to the side effects of the cannabis, like the most common thing we can see is it hampers with the brain function. Like your coordination will be gone, the senses, the delayed reaction to a certain situation. Your reflexes will be delayed, and you must be having dizziness. You must be having. So these all factors are there. But point to be noted, up till now, very few, but as per my knowledge, no death has been reported due to the overdosing of this cannabis, either in a recreational case or in the medical cannabis. So, like medical cannabis, we can say if we give a proper dose, we have no side effects, or if we have some side effects, that can be nullified very easily. So the side effects mainly include is dizziness, delayed this delayed what you call brain functions, delayed reactions, and it sometimes produce hyperacidity. It can upset the stomach, the GIT. That can be that can be counteracted very easily. The The first and the foremost thing for this treating the delirious effect of the cannabis is we can use lots of water. Like if we take lots of water, it will flush out. It will slowly and gradually flush out from the urinary system, and this side effect can be maintained at home only. If sometimes person feel that they have taken a very higher dose in a very less quantity, like they have smoked for the first time, someone has smoked the cannabis, unknowingly has smoked the cannabis, so they can directly report to an ER of a hospital, and they can take care of it. Okay.
Okay, so I guess this is what and how you manage as well these. Any key thing that one should have in mind to avoid any sort of side effects? Like, is there a preemptive measures one can take to avoid any sort of a side effect?
Yes, this is a very good question. So, for example, if someone is there and if they are willing to take the medicinal benefit out of cannabis, so first and the foremost thing that you have to keep in mind is the dose should be low and they should go slow. What the key factor is, the dose should be low and they should go slow. Means, let me elaborate. For example, a person who has not ever in the lifetime has consumed cannabis of any product, like any product in the form of edibles, or have never smoked the cannabis or ever taken a medical cannabis tincture. So what they should do is they should start with a low dose, like a dose of one drop of cannabis tincture in a water of like a lower mg concentration. Then slowly and gradually they should by the time period they should increase their dose, so that this delirious effect can be nullified, and this the body, the ECS channel, the endocannabinoid system, this can be activated properly, and the medicinal values can be obtained more easily, rather ignoring all the delirious and the recreational aspect of cannabis. So go low, go slow, take a very small quantity of this cannabis and take it slowly for a day or two or three, and then slowly increase the cannabis doses. And I would like to add one more thing. My opinion here is always contact a medical cannabis practitioner before starting any of the cannabis products, either edibles or these medical tinctures.
Understood. Understood.